So today, yet another episode with the Dr. VIKRAM AHUJA ji, and today we are at SIPS, which is in Lucknow, uh, in the heart of Lucknow near Chowk. And आज हम बात करेंगे myths और क्या जो है प्रोपेगेंडा इस्तेमाल होता है, किस तरीके से जो है हमारे टूथपेस्ट में नमक है या अलग 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 बहुत सारे आपने एक्रोनिम सुने होंगे, उसके बारे में डिटेल पे जानेंगे. और टूथ हाउ टू टेक केयर ऑफ आवर टीथ, हाउ टू टेक केयर ऑफ थिंग्स, हम उसके ऊपर डिस्कस करेंगे. सर, वेलकम टू द शो.
Hi Dhruv, thank you so much for being here, and it's nice that we can share our ideas in dentistry. What is the truth and the facts in dentistry? I'm quite happy that you people are more interested for the awareness programs. Thank you so much.
Great, sir. So starting with these commercial ads. So when we hear that हमारे टूथपेस्ट में नमक है या हमारे टूथपेस्ट में चारकोल है, हमारे टूथपेस्ट में लौंग है, इलायची है, God knows what all. तो ये जो gimmicks, should I call them gimmicks, or is this a reality as well? कि हाँ.
Yes, it is. See, at certain quantity, it is quite good for the nourishment of the gums. But putting a lot of salt in the paste, that causes a problem for the teeth. Okay. And as we all know that they are kind of abrasives, which are cutting the edges of the enamel surface. Okay. And that causes the sensitivity in the people.
So enamel is the first layer of our teeth.
Yes. Yeah. Basically, the tooth is made up of enamel, dentine, and there is a pulp chamber. Okay. And then the pulp is there. So if the topmost layer is being damaged, the enamel is damaged, the people have sensitivity. Okay. And if that increases, that causes they cannot have a cold or a hot food. Okay. And if we are putting some abrasive on the paste, and we are using it every day, that causes a damage of the enamel. So I feel that the simple paste is more than enough. And if they want the nourishment of the gums, they can use there are so many gels, and in fact the dentist is there, they can show them rather than going for themselves for a salty paste or any abrasive pastes.
Yeah, so this is also one of the major concerns which we face, that we ourselves becomes a doctor, right?
Yeah.
So it is always better to consult a doctor, right?
True, but that is why we are here.
That is why you're there. So, as per you, the normal toothpaste is the best one, right? We should not go for the different flavors and the different varieties of paste.
Well, we can go for it because sometimes many people are allergic to the mint. Okay. And most of the paste are having a mint. So they can go for a plain toothpaste, and if anybody likes a strawberry flavor, they can go for that. That's not a harm. But using abrasives like a salt particles are an abrasive, silica is an abrasive, that causes a problem.
That causes the problem.
Yeah.
So what is the basic and the best method to take care of our the complete tooth set?
Okay, so it's basically twice brushing is important.
Okay.
Like that is more important, and a proper brushing. Like sometimes patients come to us and they say that they brush 7 times or 5 times a day. So that is not a right way of caring the teeth. Okay. It is basically your 2 times is more than enough.
2 times is more than enough.
Yes.
And so once you wake up in the morning,
and once you go to a bed in the night, that's it. The night brushing is more important. Actually, people don't do generally. Okay. That is more important.
That is more important.
Yes.
Okay. Now people do flossing as well. People use different kinds of toothpicks are there. People keep this copper toothpick in their belongings, and they keep on doing that. Yeah. Is it good?
Yeah, the cleaning the interdental area is good. Basically, it is like if we are doing in a proper way, not with the metal. Metal can causes a damage of the gums. Or if there is a metal stick, it should be in a proper shape. Okay. It should be a triangular shape, because as we see the interdental spaces, we have a triangular shape. So it should be a very thin triangular shape. We can use that. See, it is basically like when we rub anything on the fingertip, it causes a hardness of the skin. Okay. It is the same thing, same mucosa is there. It's soft skin in the mouth.
Okay.
So when we are rubbing any toothpick or anything, it causes a hardness and it improves the gingival health, the gum
Gingival
health.
health.
That is gum health, yes.
Okay, so now when we talk about dentistry, right? So it does tongue care or the mouth area, does that comes under the same?
Yes, it does.
It does, right?
Yes.
So cleaning of tongue is how we should do that. Is a normal cleaning is the
No, it's just a simple brush can be rubbed on the tooth surface, on the tongue surface, and that cleans the tongue. Rather than using a tongue cleaner, that can damage the tongue rather.
That can damage the tongue.
Yes, yes.
Now coming back to one other myth that there are different kinds of foods or different kinds of juices which are not good for your tooth. Is it so? Because people say that you should avoid taking caffeine. You should avoid taking pomegranate in a pure form. Is it also? Is it?
No, that is perfectly fine. But if we are using a cold drinks or such kind of things like a fizzy drinks, that causes a damage of the enamel because it is more acidic in the oral environment.
Okay.
As our oral environment should be more neutralized rather than acidic. Yeah, that is why we have a paste of the calcium paste.
Okay.
That reduces the acidity of the oral cavity.
Okay.
Yes, it reduces the acidity because it converts it into the basic form. So that causes a more neutralization of the oral cavity. If the oral cavity is neutralized, the basically your cavity is less, and the damage of the gum is less in that case.
Damage of the gum is less.
Yes.
Okay. So definitely we have cleared two of the basic myths which we have been bombarded with different kinds of ads. One, and the second is जो दादी के नुस्खे वाले में होता था कि you should not do this it's not good for the tooth. Now moving forward. So अब हम ब्रेसेस के ऊपर कुछ बात करेंगे because more of the people जिनके टूथ में spaces are there. तो ये जो इसके लिए एज जो हम डिफाइन करेंगे तो ये इसके लिए द बेस्ट एज क्या है वंस बिकॉज देयर इज फॉर एग्जांपल एक केस के बारे में बात करते हैं अ यंग गाय इन हिज 12 इयर्स और 16 इयर्स और उसके जो है टूथ में जो है स्पेसेस हैं सो इज इट दैट अ गुड एज कि वो जो है ब्रेसेस लगाए या फिर he should wait and he should wait till 18 years and then he can proceed further?
It is basically the thing is that when we are using the braces right age is basically after the mixed dentition. Like yes. See, as we all know that there are two types of like dentition, like two types of teeth are there, like the milled tooth as well as the permanent.
Okay.
The mixed dentition is the age when there is a permanent teeth is coming up. And the milled tooth is going back.
Okay.
So that is around 8 to 10 years.
Okay.
So after 10 years is the right age after the mixed dentition. We can go for a permanent like a wire braces.
Wire braces.
Yeah. Okay. And that is basically when our roots are formed of the tooth.
So basically अगर हम basic ground level पे बात करें तो दूध के दांत जिसको हम कहते हैं वो प्रॉपर टूट जाए और fresh जो complete set of teeth आ जाए तो around 12 years is the right age for a person to get braces?
Yes, after 10 years it can be 11, 12 or we just take the x-ray and we see the formation of the root there.
Okay.
If the root is formed then we can go for braces. And right now like braces का तो late age में भी आजकल हो जाता है.
Okay.
Because there are very recent things called aligners.
Okay.
Aligners are basically, I'll show you what are aligners. Aligners are these type of plates which we generally place it and that's it. And you have to place it more often and your teeth will be straightened. There are certain there are sequence of aligners and there's a timetable which is given with these aligners.
Okay.
And in these aligners like it should be done like one aligner should be placed for 1 month, then about 20 days or 1 month. It is mentioned on the timetable. So there are different aligner plates and this straightens the teeth. Now there is the modern technique of the straightening is this. And people don't go for like people who are having good amount of money, they can go for aligners. Aligners are a little bit costlier than the braces. Yes.
So overall, if I talk about the braces or the aligners is not age specific, people at any age can go for it?
Yeah, like they can go till 35, 40 years till people can go for that. Yes.
Now coming back to one of the major questions, because in Bollywood or in movie industries these days, what people are doing is that they are using different kinds of jewelry on there too.
Yeah.
Right. So coming back to that question, is it really good, or they are destroying the teeth?
Not really. Actually, it is on the periphery of the enamel.
Okay.
So it doesn't destroy the teeth. Yes. These days, yes, the demand of the jewelry is too high.
Mhm.
Even today evening, we have a patient for the jewelry for a
Okay.
diamond. So people, yes, they book for the diamonds, and we just put on the side when they smile, it sparkles.
Yeah.
And in fact, they have a small pieces of gold on the tooth.
Yeah.
That works quite well. The placement of these jewelry, it should be on the periphery rather
Okay.
than making a groove and fitting inside. That
Okay.
can cause a little problem. It becomes more like a permanent tattoo which is on the skin.
Okay.
It is the
So
same
it's
thing.
like we are sticking the jewelry on.
Yes,
on
it should be slight on the
It
periphery.
doesn't destroy the enamel.
No, not really.
So when we're taking out that jewelry, is it so, or it should be like if the jewelry is if a person is wearing that jewelry, then it's permanent, or he can remove it.
It can be removed. If it is on the periphery, it can be removed.
It can be removed.
Yes.
Without any destruction,
Without any destruction. Yes.
Okay. So another myth we have cleared. Thank you for that. Now, one more question which I would like to ask, that during when a person is suffering or is to the suffering from different kinds of bacteria, or what should be the first step? What the first thing the person should do?
You mean to say more acidity in the mouth?
Yes, more acid.
Okay, that can be neutralized by using the proper toothpaste. Number one.
Okay.
Number two, they can use the mouthwashes.
Okay.
The mouthwashes should be placed for 30 seconds in the mouth,
Mhm.
rotating in the mouth,
Mhm.
and then just to rinse it.
Okay.
It should be time is around 30 seconds. That is
Okay.
more important,
Okay.
and that reduces makes the pH level more neutralized.
More different.
Basically, we go for the normal pH, like a neutral pH around 6.87 in the oral cavity.
Mhm.
If it is more than 7, that is acidic.
Okay.
Yeah, because the bacteria in the mouth that release the acid,
Okay.
and that causes the cavity in the oral cavity.
So there is a general practice which we do at villages, that they boil the water, they put salt, a little amount of salt, and they add the clove to that water, and then they gargle it. Is it good?
Yeah, that is fine. That is not a harm actually. They can do that. Yes,
They can do
it is not a harm. It causes, because I respect Ayurveda, and in fact that Ayurvedic medicine is very good. Of
Mhm.
course, the primitive dentistry started from there only. That what
Yeah.
we Indians says, and it is amazing.
And how about using neem and different kinds of leaves? Those are good or recommended?
Yes, it is, because it is having an antiseptic properties, like
Okay.
as the Ayurveda says.
Okay.
But I don't prefer that you should rub on the surfaces.
Okay.
And anything which is done too much in quantity, that gives an harm. If you're
Okay.
doing morning, evening, or once in a day, that doesn't make any difference.
Okay.
Yeah.
Okay. So definitely they can do it.
Yeah.
Not too much of it.
Yes.
They should not be completely dependent.
No,
on it.
no.
Now, at what age you should recommend that people should? It's not that हमारे हिंदुस्तान में तो एक प्रॉब्लम है कि जब तक कुछ इशू बड़ा होता नहीं तब तक हम डॉक्टर के पास जाते नहीं. But for a normal age bracket क्या होगा जिसमें कि we should visit a dentist even if there is a problem or there is not a problem.
I'll say that, because being a dentist, I'll just comment on that when the tooth is in the mouth, the person should go to a dentist.
The first,
Yes, of course, it should be seen that if it is coming out properly or not. The pedodontist is there. There is a branch of dentistry in which the kids are being seen. At least once they should be shown to the doctor that time.
so we should consult the the
The
doctor.
first tooth should be shown to the dentist. Yes.
Okay. That's
Yeah.
amazing.
And
And people should not. Many people don't know about it.
yeah, I know that, but even in fact, it is recommended that every 3 months one should visit a dentist.
Okay.
Yeah.
Okay. Now, if people want to come and visit over here, what is the schedule, sir, so that now they can get proper medical checkup? तो process के बारे में.
Yeah, well, I'm here in SIPS Hospital from 10 o'clock till 1 o'clock.
Okay.
And then, of course, my clinic is there. So I'm in Cosmic Dental Clinic from 4 o'clock till night or 9 o'clock.
And how
So-
people can book an appointment?
Well, there are certain numbers, and they can see the website. It's a www.cosmicdentalclinic.com.
Great.
They can go
They
there
can book
and
their
they can.
appointments.
Yes, of course, they
And
can.
all kinds of services are being covered. I believe जो हम लोगों ने पहले episode
We do
में
everything in dentistry. We do laser. We do everything.
Everything.
Yes.
Thank you, sir. Thank you for being the part of the show, and thank you for clearing out the myths, which are really important. The
Thank you, bro.
basic intake which I take, from this interview is the moment the teeth is there, the moment the tooth is there, we should consult the doctor. That is number one. Right?
Yes.
And not too much of salt. It's just a normal paste, which is fine.
Yeah.
Not too much of neem or any other things. It's just a regular use is fine, recommended. Not too much of it.
Yes.
Right? And definitely after every 3 months, a person should consult the dentist.
Yeah. Every 3 months they should go and shoot because
They
32
should.
we have.
32 we have. Thank you for coming on the show, sir.
Thank you, bro.
Thank you.